สวัสดีครับ Good morning welcome to the Insider I am Major General วีรชน สุคนทปฏิภาค Deputy Government Spokesperson This week the Insider bring you a special guest a leader of a global organization She was here to preside over her organization's biggest annual meeting the annual World Dental Congress between 22nd and 25th September This was the first time that this Congress met in Thailand. And it brought over 120 national dental associations, as well as thousands of delegates from every corner of the world. Thailand is very honored to have been the venue for this event, and we extended a very warm welcome to our international friends. The World Dental Federation is the largest organization of dental profession and represents over 1 million dentists worldwide. For more than 100 years, the Federation has been working to advocate and to educate dental health policy, especially the promotion of dental health as a fundamental part of human well-being. With this experience, the Federation is the primary global body that sets the standard for all health and the dental profession. With me today is the President of the World Dental Federation, Dr. Tin Chun Wong. We are delighted to have Dr. Wong as our guest. She has said that the country is becoming a major venue for debates on key issues in global health. To find out more about the important role of the World Dental Federation play and Thailand's role in global health, as well as hosting international events. Let's go meet her. Dr. Wong, welcome to Thailand, and once again, Sawasdee krab. Good morning. Just recently, from the 22nd to 25th of September, there was a big event happened in Bangkok in particular. That was the annual World Dental Congress. It is quite special for the dentists around the world to come to see each other, to discuss about their own profession. This Congress arranged by FDI. So would you mind sharing with me about the role of FDI?
The FDI stands for Fédération Dentaire Internationale, which is in French.
Okay.
Because it was founded in the year 1900 in Paris. But recently, as the English language has become more global, we call FDI World Dental Federation. We are a federation of dental associations and specialist groups, and we total 200 associations and specialist groups in over 130 countries. And we are truly a voice of dentistry, because we represent over 1 million dentists worldwide. And annually, we have an annual World Dental Congress. Now, the Dental Congress is especially important for FDI because three things happen together. One is the World Dental Parliament, where all our member associations gather and debate on developments on oral health, delivery of healthcare, and the many changes affecting oral health and general health. Secondly, there is a scientific program which is organized by the Education Committee of the FDI together with the local organizing committee of the Dental Association of Thailand. So I have to thank the president of the Dental Association of Thailand, Major General Pisal, and Dr. Ardirek Wongsa, the chairman of the local organizing committee, in creating this magnificent scientific program, drawing speakers from around the world to deliver their findings and their recommendations, opinions, and comments on the delivery of oral and dental care to their patients. Thirdly, there is a big dental exhibition. Amongst all our partners is the International Dental Manufacturer, and the exhibition is important because it is where dentists can look at new products, they can see, they can touch, and they can feel and test the equipment that they can use to deliver better care to their patients. So three things happen simultaneously, and this is why it is an important event.
Well, this is indeed a world-class event that happened in Thailand.
Yes.
If I am not wrong, right now we have at least 193 countries as a member of United Nations. And why Thailand? Why you choose Thailand? I must thank on behalf of the Thai people, thanks you for choosing Thailand, choosing to come to Thailand. So would you mind sharing with me and tell the Thai people why you come to Thailand?
Well, first of all, before we choose a country, we want to see what is the oral health care delivery system available in that country and what situation it is. Secondly, we want to see the infrastructure, whether there is a suitable convention center, whether there are adequate hotel rooms to provide for participants, because on average, we expect around 10,000 participants in our annual dental congress.
10,000, that's a big.
Yes. I mean, plus and minus. Sometimes it's over, sometimes it's just slightly under. So we're talking about that kind of number, not 800. So we need to see if there are adequate hotel rooms. Thirdly, there is the transportation system that we need to be concerned about. For instance, our dentist members fly from all over the world. Accessibility to that country must be relatively simple. So we tend to choose a city where there is excellent airport facilities, transportation to hotels and convention center. And lastly, of course, the climate. We cannot go to a place where the climate is unfriendly. Our participants must be able to arrive and be comfortable and enjoy the facilities and the sights and attractions of that country. Now, when we chose Thailand, we saw and we knew for many years that the Dental Association of Thailand is remarkable in its management and policies regarding to oral health delivery to their patients. And the way they look after the profession is also very important. The education delivered, whether it's undergraduate dental training or postgraduate continuing education program, these are important issues that we look at. And Thailand is very sophisticated in this. On top of that, His Majesty's Charitable Foundation on Dental Innovation is a remarkable achievement in that your royal family supports the oral health of the population. This is not seen in many countries. So we chose Thailand because of all these reasons. One, it is a country of peace and tranquility. The people are charming and gentle.
Thank you.
And of course, there are situations whereby all this is threatened, as in many things in the world, and you have coped with them very, very well. The climate is endearing. The gastronomic delight is a very attractive thing for our members to come to enjoy. Your transportation system is excellent with your SkyTrain. Your hotels are top world class, and your service is amongst the best in the world. So these are the many reasons why we decided to come to Thailand.
Oh, thank you so much. I feel overwhelming by listening to you talking about the confidence you have for Thailand. And once again, thank you very much on behalf of the Thai people. You have touched on the issue that perhaps related to profession. What about yourself? How many times you come to Thailand, and what do you like most about Thailand?
Well, this year, this is my third visit.
Your third visit?
I come very often.
Ah.
Yes. The attraction of Thailand, for me personally,
Yes.
is your Thai silk.
You've been wearing the
love
Thai
it.
silk. Thank
Yes.
you.
And the people, as I said. I have great friends here. Dr. Adirek Wongsa, Major General Pisau, and many members of the Dental Association of Thailand are my dear friends. And you have wonderful beaches, wonderful food, wonderful shopping facilities. So it is a place to come for relaxation, for enjoyment, and to meet friends. This is my personal view. So added to that, an opportunity to learn how to improve our technique and our delivery of oral care and treatment to our patient is an added bonus.
Well, I hope that you will come to visit Thailand more often and help our economy. And of course, you're talking about the Thailand dental standard. And of course, the current government is now working on making Thailand become the medical hubs. And dental standard is one issue that we are working on. How do you see the standard of the dental in Thailand?
Oh, dental standard. I mean, the dental care.
The dental care
standard. I would say is a comparative to any top class standards in the world. I've just heard that 30% of the 15-year-olds are caries-free. I mean, that is a wonderful thing to have happen. Another thing is that we all know that populations are living longer. Life expectancy is increasing. So the care of our teeth are become more and more important as the population ages into the elderly group. I have no hesitation in recommending people to come and study, to visit, and to enjoy the facilities of the dental schools in Thailand.
Oh, thank you. Thank you so much once again. I just want to share with you that among the members of ASEAN, we are together 10 nations.
Yes.
And we have a goal, we set a goal to become one community called ASEAN Community. And of course, it would be one community. A community of 600 population. How do you see Thailand can play a role in terms of dental care for the region?
600 million population.
600 million population.
600 million population. I mean, ASEAN includes Singapore. Singapore is an extremely sophisticated country and city, and they have some of the highest standards in medical and dental care. Thailand is not far behind. Okay. And there are countries which are a little bit, for reasons of economy, politics, or climate or weather, they have suffered devastation to their economy, and they have to catch up. I think it is a wonderful thing to have a community in order that you can exchange and share, to network, and to help each other. And I think Thailand has a lot to offer.
Wow, that's quite impressive.
Yes.
And of course, the dental health is quite important. And the royal family in particular has played such a vital role in providing health care to the rural area, people in the rural area. Do you have any suggestion for the Thai dentists? How can they play their role in supporting the oral care of the country? Because we are talking about sustainability. We also consider maintain a good health is one way of making society become sustainable. So how do you see the role of the dentist in Thailand?
Well, sustainability is very important. I mean, we must be aware that dental treatment, wherever it's given, is the fourth most expensive medical treatment in the world. All right. No country can afford to provide absolute total dental treatment to every member of its population in the highest quality care. This is what I'm talking about, because dental treatment is very expensive. Now, but dental diseases are 98% preventable. Right. It doesn't have to happen. So prevention is the key. And FDI in this Vision 2020 has elaborated and called for prevention of the development of oral and dental diseases. And we know what is causing dental disease, the dental decay, for instance. And we advocate a collaborative approach to arresting this disease, preventing it to happen, and even when it happens, it is only in the earlier stages. So it is important for dentists or dentally trained individuals to preach this prevention method, whereby it lightens the burden on the patient, because we know that dental disease is painful, it's uncomfortable, and it's costly, not only for the treatment, but your research dated 2008, that 1 million school children on that, in that year miss going to school because of dental decay and dental treatment. And this is not counting the number of parents who have to stop going to work to take the children to the dentist. Now, can you imagine if 1 million school children miss school?
So you are saying that
quite a burden.
By taking care of the oral health for the population, we do need to provide them information or knowledge in order for them to prevent themselves to become like get affected by the oral disease. Other than that, as you just have mentioned, the dental care is quite expensive.
It's very expensive
for all. As you are in this industry for quite some time, any possibility in the future that we can lower the price of the dental care? For example, right now we are working hardly on innovation. I mean, science innovation is quite significant for every society, every country. And by emphasize on that, any possibility to apply that kind of thing to lower the cost of dental care, because with the high price of dental care, it will be very difficult for the people in rural area to get access to the dental treatment.
Yes.
Any possibility in the future?
This is what I was saying, because treatment of dental disease, for instance, dental decay, is a very sophisticated, a very complicated treatment. It's not simple. Or shall I say the most simple is to pull the tooth out, all right? And then you cripple that person for the rest of his or her life. So do you want to cripple? Or do you want to pay a high price to restore a tooth? Or do you want to make sure that the tooth never get disease? The cheapest treatment is no treatment.
No treatment. That's
zero.
Absolutely right.
Yes.
You are absolutely right. Then I see that the event, the Congress, took place in Thailand is one of the very significant events happened in Thailand. Apart from sharing information, sharing knowledge among the dentists throughout the world, all over the world, you also display the confidence that the member of FDI having for this country, for Thailand. And I hope that by having all of the member of FDI to come to Thailand would reflect that Thailand is now still ready to welcome visitors from all over the world. And as I mentioned earlier, and you also mentioned that we've been passing a lot of difficulty with many situations, but Thailand still cope up with the situation quite well with the being resilient of the resilience of the Thai people. And if I may ask you to once again talk about the confidence that you personally and you as the dentist profession having for this country, what would be your words?
I think the most wonderful thing I heard is from today, 30% of your 15-year-olds are caries-free. That means they are decay-free, which means that they do not need any treatment, which means that their treatment is zero cost. There's no treatment. And as we were talking about sustainability, this group of 15-year-olds are very, very fortunate. And if this group can increase from 30 to 100%, then you are winning. Now, you talked about rural. We must differentiate. Rural population very often do not have serious dental diseases because their diet is very healthy. It is the some of the sophisticated diet, which is a lot of processed food, a lot of refined sugar, refined carbohydrates, that is causing a lot of the pain and suffering of dental disease. So a really rural or even tribal area have extremely low dental disease. So it depends what kind of rural situation you are talking about. No, it's true, yes. And as we all know, we knew 150 years ago, it's carbohydrates, especially refined carbohydrates, like sugar, which cause dental decay. So I can say it very simply: no sugar, no carbohydrates, and no decay. But can human beings live with no carbohydrates? And that is another thing we have to
putting
think
on weight
about.
as well.
Well, this is a very important issue because oral health has a lot of common risk factors with non-communicable disease. For instance, sugar. We go into diabetes, obesity, and heart problems, right? And a lot of that is linked with weight control and overeating. It could be. So we share a lot of common risk factors. So a person who does not have any dental disease probably have a very good diet. The good diet will make him or her a little bit less prone to obesity, diabetes, and heart problems. So you have a healthier population. Yes, but the details of those risk factors, of course, are in the hands of the experts. Yes, but generally we're talking about sugar, alcohol, tobacco, and diet.
Yes.
Yes.
Well, Dr. Wong, time really flies, and of course, I must thank on behalf of the Thai people as well for bringing this event to Thailand. It is quite important for Thai people and for the country, and of course, not only that, but you also bring knowledge, bring awareness to the Thai people, and perhaps this can be, a wake-up call for many who neglect their oral care. And of course, once again, I am grateful for having you with our program, and of course, thank once again on behalf of the Thai people bringing this Congress to Thailand. I hope that you will come back again to visit us, and please come back to visit us as often as you can, as you like. Thank you very much.
I already planned to visit again. But before we go off, you are in the media, all right, and the message of good oral health is the most important. Yes, that it is preventable, that we don't have to suffer the pain and suffering, of dental diseases.
Well, thank you. I would keep that in mind, and I would try to spread this word to the public. Prevent is better than cure.
Yes.
Thank you so much.
Thank you very much indeed. It's been a pleasure.
สวัสดีครับ
Thank you. Thank you.